Welcome to another episode of Talking with Docs. I'm Dr. Brad Whitney.
And I'm Dr. Paul Zalzal.
Hey, Paul. Talking about a very interesting, very important topic.
Lay it on me.
The top 10 reasons that you should seek a consultation or further investigations if you have low back pain.
Low back pain. That is so common.
It's very, I think almost everyone has it at some point in their life.
It's almost I think I read 70% of the people do. It's almost physiologic in some cases.
Sure.
But it is very common. However, it can be extremely debilitating.
For sure.
And most of the time, it's mechanical low back pain.
What does that mean, mechanical low back pain?
It just means it's a mechanical pain that you're feeling. It's kind of a term that encompasses something that says we don't really know what it is.
Yeah, it's kind of like nothing specific. You just got back pain. And we can't fix it. Yeah.
However, there are 4 things that we have to rule out.
Okay, let's go.
Okay, the first thing we want to rule out is to make sure it's not broken.
Right.
Do you have a fracture?
Right.
Okay. That is not mechanical back pain. That's something may need medical attention immediately. Okay. Cancer.
Yeah.
Is it cancer? Is it a spread of cancer to the back?
Yep.
That is something we want to rule out.
Okay.
Infection.
Yep.
Got to rule out infection. Make sure there's not a discitis or an infected disc.
Right.
And the last one is Cauda equina syndrome.
Ooh, sounds so fancy.
It sounds fancy because it's Latin.
Ooh, Latin is fancy.
Or Greek.
A lot of medical terms, come from Greek or Latin just because they kind of discovered modern medicine.
Yeah, because it doesn't sound as good if you say it in English. What does Cauda equina mean?
I think it means horse's tail.
Right, it's referring to the end of the spinal cord where all the nerve roots come out, somewhere around your L1 area.
Right.
And I guess hundreds of years ago when they were naming anatomy, they looked at it and said, oh, this looks like a horse's tail. And the guy said, you can't call it a horse's tail. They said, well, what about a Cauda equina?
Ooh.
That's brilliant.
I like it.
And we always hide behind Latin terms, right?
Sure.
You know, if you see a patient with a contracture in the ankle, you'd say, oh, you have an equinus contracture.
You're like, oh.
The patient's like, oh, thank you, thank you. And then you go to the lounge after and go, I just told a patient that his ankle looked like a horse's.
There you go.
And he thanked me for it.
There you go.
Because it's in Latin or Greek.
It's like if you said it with a British accent.
It's always bad with a British accent. All right, so those are 4 things to rule out: fracture, infection, cancer, Cauda equina syndrome.
Right.
So we got 10 things to watch out for that might be red flags, that it might be one of those things.
Right, so number 1 kind of falls into that first category of a fracture. We worry about trauma. So you have a history of significant trauma. So maybe a car accident, falling off your bike, or particularly falling from a height. When you land on your heels, the force that goes up through your feet, it can break your foot or your ankle, but also goes up into your back and cause compression fractures potentially of your spine. So if you have significant trauma, that's a reason you maybe should think about getting your back pain investigated.
Right, so you're living your life, you're happy, all of a sudden you have trauma, now you have back pain, you need to go get help with that.
Okay.
Number 2, if you have a loss of bowel or bladder function, that could indicate there's a neurologic problem going on.
Right.
And it's actually one of the signs associated with Cauda equina syndrome, where that horse's tail, all the nerve roots at the end of the spine, the spinal cord are getting compressed, can lead to paralysis. Loss of bowel or bladder function, go see medical specialist.
So those nerves are responsible for the involuntary starting and stopping of both voiding and defecating. So if you lose control, so sometimes you'll retain them and you're not able to go, or sometimes you go without wanting to go. So both of them are dangerous. Okay, number 3, if you have numbness or tingling, and that could be in your upper body related to injury of the bones of your neck, or your lower body of the bones of your spine. So if you have numbness or tingling, those nerves are being compressed, they're being irritated, and that can cause abnormal sensation in your limbs.
Okay, so that's another red flag to go seek medical help. Along the lines of neurologic problems, a foot drop, we call it. Okay. That's where you can't bring your ankle back, okay? You kind of lift your leg and your toe points down.
Yep.
You lost that neurologic control. That could be an indication that you're having some neurologic compromise in your lower spine. And if that happens, you should go see a doctor.
Okay. Number 5 is night pain. So in general, if you have pain when you're walking, when you're standing, when you're lifting, those all kind of make sense and they have a reasonable explanation. If you have pain at night, or particularly pain that wakes you up, this is typically a sign that something more serious is going on and that you probably need to get it investigated, whether this is in your back or elsewhere. So it's called a constitutional symptom. So if you have pain at night, this increases our nervousness and our awareness of maybe we need to get something looked at.
If you have pain at night, it ain't right. Is that what you're trying to say?
That's a good way to remember it.
Okay, number 6, red flags associated with back pain, fever. If you have back pain and you have a fever with it, we worry about infection. We mentioned that before, discitis or an osteomyelitis or some sort of infection in your back, that needs urgent treatment.
And this relates to the way the blood vessels feed our bones, and sometimes a bacteria can end up in our bloodstream, and then the way it pools in our spine can lead to these types of infections. So you don't even need a specific injury. It could come from a needle or from a knife, I guess, theoretically, but usually it just comes from our bloodstream. So you gotta be careful with that. Number 7 is unexplained weight loss. So the thing about this is somebody like, hey, you know what's really cool? I just lost like 12 pounds. And they're like, oh, what'd you do? I didn't even do anything. The weight's just going away. It doesn't happen very often, and it shouldn't happen if you're not trying to. So if this does happen to you, it can be a sign that something bad is going on. And the reason is, particularly processes like infection and sometimes unfortunately like cancer, these are catabolic processes. So they require a lot of energy. So the process itself is consuming a lot of energy, which causes you to lose weight, which obviously in the very, very short term you seem kind of happy about, but it can be a definitely red flag and a dangerous sign that something not right is happening.
Very important one.
Yes.
And then this one is important too. This next red flag, we're on number 8 now.
Yeah.
Okay. If you have a history of cancer, or you're on some sort of immune suppressant for some reason, and then you develop back pain all of a sudden, or even like insidiously over the next few days, that could be a problem. That could be a sign that, hey, your cancer has come back, your cancer spread to your back, okay? So history of cancer, now you have back pain, that needs to get checked out.
Right.
It probably isn't, it's probably just mechanical back pain, but it needs to get checked out.
Okay, number 9 is prolonged pain. So even if you have pain for 2 or 3 days, it feels like that's prolonged pain, but that's not what we're talking about. We're talking about pain like longer than 6 weeks. So a lot of things in medicine, particularly in orthopedics, are kind of going to work themselves out over a period of 4 to 6 weeks. If you still have pain after 6 weeks, and particularly pain that's either staying the same or certainly if it's getting worse, this is something that needs to be investigated. So you can't just say, oh, it's just my normal back pain. If it's sticking around for a long time, it still could be mechanical low back pain, but it increases the chances that it's something more serious and may need either further investigations or potentially treatment.
Now, a lot of you may have back pain that has gone on for more than 6 weeks, but we're saying if you've never had back pain, all of a sudden you get back pain and it lasts more than 6 weeks, it needs to be investigated.
Good point.
It could be investigated and ruled out that it is not one of those big bad 4 things, and you have chronic back pain, that is very, very common.
Right.
But for new onset, you don't want to last 6 weeks.
Okay, number 10, drum roll.
Age. The book ends at age, okay?
Right.
If you never had back pain and you're elderly and all of a sudden you develop back pain, that could be a sign of a fracture, or most likely a compression fracture, an osteoporotic fracture, or one of the other things we mentioned. Or if you're really young, I always tell patients that kids shouldn't get back pain.
Right.
Okay. If a child gets back pain, that needs to be investigated.
Even a young adult, because I remember when I was like 19 or 20, you could stay up all night, sleep on like a rock, get up 2 hours later, wake up, feel pretty good.
Yeah, man.
Now you got like the Certa Perfect sleeper with a pillow top mattress and 1,000 thread count sheets in an environment that's totally controlled. You wake up with back pain.
If I look at something heavy, I get back pain.
Right.
Well, it was like a heavy rock.
So it doesn't have to be even a super advanced age. I feel like sometimes it starts at middle age, but definitely if you've been fine and then all of a sudden you have back pain as an adult or an older person, this is something to be concerned about.
Or a child. Okay?
Or a child.
Or if your child is having back pain, it's like, wait, get that checked out.
Okay.
So those are 10 red flags that will help rule out one of the big bad 4 things, right? If you have one of those 10 things, you need to get it checked out because we're trying to rule out cancer, fracture, infection, Cauda equina syndrome.
Okay. If you like this video, we hope you don't have back pain, but please like it, subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.
Probably odds are whoever's watching this has back pain.
That's why they
most
searched
people have
it.
back pain. Well, even without it.
They searched it like, you know, my back hurts now.
Right.
See you next time.